Yeah, Lisa, please go ahead.
Good afternoon, namaskar, and welcome to another edition of our webinars in the series Illness to Wellness. Today, we are going to have very important discussion on a topic which is very close to all of us, which is very important in the life of all of us. You see, the world is beautiful. Why is it beautiful? It is beautiful because we can see it. What if something happens to our eyes? What if we cannot see it the way it is or the way we can appreciate it? So we need to have healthy eyes. And how to do that? How to prevent diseases of the eye? How to have a good vision? All this we are going to discuss today with a very eminent panelist, specialist, not only from our country, but I would say from all over the world, who are going to enlighten us, who are going to answer your questions, and who are going to give us information about how to keep our eyes healthy, our vision even better than it is. So we're going to discuss managing eye care in this edition of our webinar. We've been doing these webinars since almost 2 years, and we've been covering very different topics related to health, especially during the COVID period. I'm very thankful to ASSOCHAM, which has been organizing these webinars, and especially I'm very thankful to Shri Anil Rajputji, who's heading the CSR Council of ASSOCHAM, and I would now invite him to start the webinar officially and introduce our esteemed panelists. Sir, over to you.
Thank you, Dr. Kesri. You've been my partner for the last 2 years in engaging with so many eminent personalities who have come and share their experience and knowledge. And it is my proud privilege today to welcome Padma Shri, Dr. Professor A.K. Grover, Chairman, Vision Eye Care Center, and Chairman, Department of Ophthalmology, Sir Gangaram Hospital, New Delhi, Dr. Subina Narang, Professor, Department of Ophthalmology, Government Medical College, Chandigarh, Dr. Reena M. Chaudhary, Director, Shankara Netralaya Glaucoma Services, Senior Consultant, Glaucoma and Cataract Services, and Chief Operating Officer, Eye Care, Eye Hospital, and PG Institute, Noida. Dr. Rajesh Kesri, Founder and Director, Total Care Control, Delhi, NCR. Good afternoon and warm welcome to the webinar on Managing Eye Care, organized by ASSOCHAM under Illness to Wellness campaign. The month of February has been globally dedicated as the Low Vision Awareness Month. The Low Vision Awareness Month has over the years generated large-scale awareness and consciousness to protect one of our most important senses, the eyesight. Established by the US-based National Eye Institute and National Eye Health Education Program, it fosters support, proper treatment, and vision rehabilitation for people living with diminished eyesight. A 2021 Lancet report stated that in 2020, 1.1 billion people had vision impairment, including blindness, and millions more with ongoing eye care needs around the world. It is also estimated that by 2050, 1.8 billion people will be living with vision-related issues unless significant steps are taken for managing eye health. Global estimates indicate that India is home to about 20.5% of world's blind, 22.2% of world's low vision population, and 20.9% of those with vision impairment. It is evident that as populations age, there will be an increasing disease burden of vision-related disorder. While common reasons for moderate to severe visual impairment are cataract, undercorrected refractive error, glaucoma, and diabetic retinopathy, vision loss in young people is usually caused by inherited eye condition, infection, or trauma. Additionally, the COVID-19 pandemic has also resulted vision-related problems, especially among young children. The switch to digital learning over the last 2 years has led to young students staying indoors and spending longer hours in front of their TVs, iPad, mobile phones, and so on. Many children use devices round the clock for both school and play. This, combined with delayed vision screening during the pandemic, has resulted in uptick in new cases of children's eyesight as well. With 80% of what we perceive among through these sense of light, it becomes imperative that adequate steps are taken to protect our eyes. To my mind, having a regular eye examination is crucial first step in eye care. In observance of Low Vision Awareness Month, I encourage everyone to have a complete eye exam from a licensed ophthalmologist. Getting a yearly exam increases the chances of early detection and diagnosis of conditions that may lead to vision loss. Good, high, good eye health also needs healthy and nutritious food on your plate. Nutrients like omega-3 fatty acids, zinc, vitamin C, and E might help ward off age-related vision problems. For children, apart from feeding them a rich, balanced diet, it is essential to see that the lighting of the room is conducive to their eyes while they are studying. Correct sitting postures, controlled screen time, and regular eye exercise are also vital for maintaining the health for their eyes. Learning about the causes and the risk factors related to eye health and taking preventive measures is key to protecting your sight as you age. For people with low vision, maximizing their remaining sight is crucial to help them continue to live safe, productive, and rewarding lives. Good vision contributes to our improved physical abilities, learning and comprehension skills, and a better quality of life. Therefore, keeping an eye on your vision health is undoubtedly an essential component of good health and overall well being. It is a matter of great satisfaction that we are joined by leaders in the field of eye care today and, and their experience and expert view on subject at hand would greatly help our understanding. I welcome them once again and look forward to an enriching session. I wish this webinar a great success. Thank you and Jai Hind. Over to you, Dr. Kesri. Thank you very much.
Thank you so much, sir. Thank you so much for this wonderful introduction to the topic and the problem that we have of about vision in our country. Thank you so much. And indeed, we are privileged to have such an esteemed faculty as panelists today with us. Without further delay, I think I would start the session immediately, and I would like to come over to you, sir, Professor Grover, to give a brief introduction about our eyes, even though we know that eyes are beautiful and we know that we see through the eyes. So how do we see the world as we see it? So I think you are muted. Please unmute yourself, sir. Professor Grover, sir, please unmute yourself.
Can you hear me now?
Yes, sir, we can hear you now.
So thank you, Dr. Rajesh, and thank you, ASSOCHAM. Thank you, Mr. Rajput, for that wonderful introduction and for this opportunity to discuss this important subject with members of ASSOCHAM. Eye is the most important sense that we have, and the eyes and the process of seeing is really a wonder of nature or a gift of the Almighty. It is a wonderful structural marvel and it is a wonderful functional marvel, the like of which no artificial optics or artificial work has been able to create now. It is said to be an apparatus with about 375 megapixel of resolution with many more properties which no artificial camera has ever been able to produce or will ever be able to produce. So it's a marvel in the sense that we have an apparatus which alters its focus for near, for distance, for any intermediate distance that we may like to look at. The optics that focuses the lights perfectly onto a light sensitive layer, which is marvelous in its construction, that it gives us a huge peripheral vision. It gives us a very sharp central vision. It gives us the color vision. It gives us the contrast vision and everything that we need for our survival and for appreciation of aesthetics. And not just that, through a very intricate system, it transfers it to brain, where the two eyes are able to coordinate together, to be used together, to be able to see that third dimension called stereopsis, to interpret that as colors, as movements, as appreciation of all that is so beautiful around us. So it's an absolute marvel, and that functioning of that anatomy and physiology could have only been done by a marvelous artist himself. So we must appreciate and protect that marvel of God with our due care and by our due sense of gratitude towards this gift and towards our duty for looking after it.
Thank you, sir. Sir, could you please elaborate a little bit? So, what is the situation in our country? Are we losing sight due to disease? So, what is the condition of eye care in our country?
The country has a large population, aging population as well, and we were at one time 1/4 of the total burden of blindness in the world, with the cataract being the commonest cause. Over a period of time, the National Program of Control of Blindness was initiated in this country, which has brought about a very significant change in the scenario. The prevalence rates were approaching 2% for blindness in this country, which were reduced to 1.5% a decade ago and are now at 0.36% in the latest survey in the total population. That means 0.36 out of every 100 persons, which means 1 in 300 persons is blind. But if that prevalence is taken for over 50 years of age, it is 2%. So 1 out of every 50 individuals over the age of 50 has blindness. And of course, the magnitude of those with a handicap, visual handicap, is much larger. So this is a huge magnitude. The efforts of the government with the help of non-governmental agencies have borne a lot of fruit, so that the largest cause of blindness, the cataract, has been tackled well. But that brings us to a number of other challenges, which means diseases like corneal diseases, where the eye transplantation or corneal donation is so important, or eye donation is so important. And these glaucoma, where silent blindness can occur, that damage to the eyes because of diabetes, which is also your field, Dr. Rajesh, which you so well know about. The blindness caused by diabetes and conditions like age-related macular degeneration, number of congenital conditions as well. So these conditions have become increasingly important. Trauma has become an important cause for blindness. It is important for us to be aware of these as policymakers, to take care of these issues as well, provide facilities for taking care of preventable causes like diabetic retinopathy, age-related macular degeneration, glaucoma, to diagnose them early. And government has made a lot of effort in that direction. So these are the important causes of blindness in our country, and we need to be stepping all these up. But at the same time, primary eye care is another weak area that we've had, which is related to the primary health being provided in the rural areas. And that is one more area which our policymakers should be taking up over the next few weeks and few years to tackle.
Thank you, sir. Thank you so much. Definitely, you have made us aware about the magnitude of the problem that we are facing as a country. Maybe in cities like Delhi, we don't realize the magnitude of the problem, but I think it is much more widespread in areas where the larger population of our country lives, that is in the rural areas and the smaller cities and towns. Thank you so much for enlightening us, sir. Now, I'd like to come over to you, Dr. Reena. Ma'am, tell us about the silent disease glaucoma, because the number of glaucoma patients are increasing and they don't understand the damage that is being done to their eyes and that they're on the verge of losing eyesight. So, what is glaucoma? Why is it important to treat it?
Yeah. So I think, as Dr. Grover just mentioned, that cataract was the main cause of blindness that was highlighted all along. But now, as the longevity is also increasing and the awareness about other eye diseases which can cause irreversible blindness is also becoming very important. And glaucoma actually is the second most common eye disease that can lead to blindness in the elderly. But it's also a disease that's highly underdiagnosed. So if you look at the data, which tells us that about maybe 12 million people in India are suffering from glaucoma, out of which maybe half of them are not aware of the disease or are not even diagnosed. The challenge with glaucoma is that in the initial stages, the patient does not have any symptoms, because glaucoma is a disease where the nerve that connects the eye to the brain can slowly and progressively damage, causing irreversible damage to a field of vision. So what you start losing to begin with is part of your field of vision. And as we use both our eyes to see the world around us, the early damage in the field is very often not recognized by us. By the time people realize something is wrong, the damage to the field has already become quite advanced. And because this disease is not reversible and curable, it is important to detect it in the early stages so that it can be treated appropriately to delay or stop it from progressing. So that's the challenge. And the glaucoma challenge also rests on the fact that the awareness is not enough. And we need to raise awareness not among just the population, but also among the health professionals and the other people who are involved in helping detect this disease earlier. Let's say the optometrists or general physicians, where patients might go. And because very often in India, everybody is not getting annual eye checkups. They're not going to ophthalmologists to make sure a routine, complete eye examination is done. That I think is extremely important to pick up diseases like glaucoma or diabetic changes in your retina or age-related early changes in your retina, sometimes myopia-related problem, because now we are also facing a huge challenge with myopia. Myopia is basically minus power in your spectacles that people need to see the world better. And as you must be realizing also all around us, more and more people are now requiring glasses. And there are many reasons for it. And myopia also increases the risk of glaucoma. So glaucoma is not a uncommon disease. And knowing about the disease can actually help people reach out for their regular checkup so that it can be detected.
Thank you so much. That was very interesting. Dr. Reena, एक बात बताइए, what could be the symptoms, or how can one realize कि मुझे glaucoma हो सकता है, I should go for a checkup? Are there any such symptoms which a lay person would experience or would know? ऐसा कुछ है क्या?
So because glaucoma is very often asymptomatic, to tell people to watch out for the symptoms and go to the doctors for, when they get symptoms might not be the best approach, but yes, in some situations, symptoms like headache, halos around the lights, which are not so common anymore because we are seeing a different profile or different presentation of glaucoma now. Earlier on, we used to mention a lot about that. Quick change of your eye power after the age of 40, where your numbers changing very quickly. These are some of the common problems that patients might feel with glaucoma, but very often the symptom that patients come to us is advanced loss of field. They're not able to cross the road. They're having difficulty with the depth perception. They don't realize somebody's crossed them from the side. Things like that happen, but that is too late. So in the initial stages, really, there are not many symptoms to watch out for. But the important thing to remember is what are the risk factors for glaucoma development. Anybody above the age of 40, 50, people who have family history of glaucoma, people who wear a power of minus number or a plus number from early age, people who have diabetes or hypertension, people who have had injury to the eye or previous surgeries, of use of steroids in any form, whether they're inhalers, creams, oral steroids, or eye drops, which have steroid formulations. These are the risk factors which can make you prone to glaucoma. So that is what is most important for you to remember, and get your annual checkups to detect it in time. Symptoms which are shown in the later part of the disease, like headaches, loss of vision in one eye, reduced visual field, are something that, yes, you should know about, but might not be the best approach to wait for those symptoms to show up before you go.
थैंक यू सो मच डॉक्टर रीना. अगर हमारे दर्शकों को, श्रोताओं को किसी की फैमिली हिस्ट्री है, डायबिटीज है, ब्लड प्रेशर है, तो आप सब लोगों को साल में एक बार तो आई चेकअप कराना ही चाहिए. बट if there's any such family history and significant risk factors, as Dr. Reena has mentioned, you must get your checkup, your eye checkup, to rule out glaucoma. Thank you so much, Dr. Thank you so much. Now, I'd like to come over to Dr. Subina, ma'am. Ma'am, tell us about the problems that are faced in the retina, that is the light sensitive part, because as we've been discussing, there are a lot of problems caused because of disease, very, very common disease, which might be affecting almost every third to fifth person today in major cities like Delhi, and in metropolis like diabetes, and almost 1/3 of the adult population is hypertensive and uncontrolled hypertensive. So what are the problems faced by them? How do they lose vision?
Yeah, the thing is that these are vascular diseases, diabetes and hypertension. So eye is the window to systemic diseases. Here we can see what's happening exactly all over the body. So here we have full information about what's happening to the vessels of the heart, vessels of the kidney, with your disease, which could be diabetes, which is affecting multiple systems, and hypertension again, which is affecting multiple systems. And I would say that, like you were just, we were just discussing before this talk, you have the camera right there in your clinic, being an endocrinologist. So most of the people should be having it, because we all have less time. We want to go to one doctor and that's it. They would go to a diabetologist, get their consultation done, and then they would not bother to go to an ophthalmologist. So diabetologist always tells, please visit ophthalmologist, because you have to pick up the disease before you are symptomatic. So we usually treat people when they're asymptomatic, and we come with beautiful results that patient keeps on seeing throughout the life. But in case they miss that bus and they come to us after they've lost the vision, that becomes difficult for us to get back that vision. Right? So it is that they have to get normal screening, which was pointed out that you should maintain whatever vision you have. You should maintain the gift of sight. For that, you have to be visiting at an ophthalmologist annually, or maybe in diabetes, it could be 3 to 6 months. So you have to be, you will be guided by your physician only to go to a doctor. And the best thing is now telemedicine coming up. If you have a camera with your primary physician, healthcare physician, and he's clicking the picture and doing teleconsultation, and you'll go to an ophthalmologist only once they say, okay, now you come, you need treatment. It's a very simple treatment. You could get laser done, which would prevent sudden drop in vision. You could get anti-VEGF injection. Now there are a lot which is done by injecting into the eye. So that can be done, those kinds of things. So I would say yes, visit to an ophthalmologist, which is on annual basis or maybe 3 to 6 months becomes a must. And the normal problem which we face is that many of the people are not trained in retina checkup. So what we see in periphery like Delhi and big metropoles, they have a person looking at the retina. But if you go down to the peripheral areas, or maybe Bathinda only is not that much periphery, but they do not look at the retina. They would go ahead with cataract surgery, which is bread and butter of most of the ophthalmologists. And if you do cataract surgery without looking at the fundus in a diabetic patient, the visions could worsen. So you have to treat the retina first and then go ahead with cataract surgery. So that is why examination of retina becomes very important. So I would say that's it.
Thank you. Thank you so much. Thank you so much, ma'am. And you very aptly said that eyes are the windows to the heart and to the blood vessels of the body. So much information can be revealed and gathered about what is happening inside the blood vessels just by looking inside the eye. So thank you so much. और अगर आपको डायबिटीज है तो साल में एक बार, अगर आपको कोई भी तकलीफ नहीं है, तब भी आपको अपनी आंखों की जांच कराना बहुत आवश्यक है, क्योंकि डायबिटिक रेटिनोपैथी का अगर समय पे इलाज शुरू कर दिया जाए तो पूरी तरह से अच्छा इलाज हो सकता है और आंखों की रोशनी बचाई जा सकती है. Thank you so much, ma'am. So, Professor Groverson, I'd like to come to you and I'd like to ask you some very simple question, which actually I think is very complex. So, what are the common symptoms of eye problem, which if any of our viewers is having, they should immediately go for an eye checkup?
Thank you. That's a very important question. But as was stressed both by Dr. Reena and Dr. Sabina, regular checkup is imperative. Once or twice in the preschool age group, during school stage, at least every couple of years, and after the age of 40 every year. These should be regular checkups even for an asymptomatic person, because so many diseases occur silently with consequences which are so bad for the health of the eye. Our objective of Pashyema Sharada Shatam will only be achieved if we are proactive and have our eyes checked regularly. Then, of course, there are several symptoms which point to eye diseases. Inability during the childhood, if there is inability to focus clearly, see the objects on the blackboard or on the television, the child tends to go closer or tends to screw his eyes or squint his eyes. Those are early indicators that an eye checkup is called for. Of course, if there are conditions like eyes that show movement, abnormal involuntary movement, or a whitish reflex, or an abnormal structure of the eye, those are all reasons why children should be taken to the hospital or to the eye doctor. In the latest age group, there are a number of things that can tell you that something may be wrong. Again, eye strain is a very common problem. The occurrence of tired eyes, fatigued eyes, burning sensation in the eyes, symptoms of dry eye like irritation, foreign body sensation, burning, or blurred vision at times. All these redness of eyes, all these are indicators of dry eye. Those people need checkup. But if you get any more visual symptoms like distortion of objects or haziness of objects, or you see multiple images around the light, or you see color halos around the light, they may be indicative of more serious conditions like cataract and glaucoma. Or distortion in vision may indicate the retinal changes, as in diabetic retinopathy or age-related macular degeneration. So any visual distortion or visual symptoms occurring are a sure indicator that a medical attention is needed. Of course, conditions like a conjunctivitis or a corneal ulcer, where you get redness of eyes along with pain of eyes. So if you get redness and pain, yes, certainly that is an indication. If you get blurred vision, certainly you should seek attention of a specialist eye doctor. There may be milder conditions like eye strain or at times just redness without any discomfort or pain, which may be taken care of by a general doctor or by um, a local person in a district hospital or in a city. But if more severe visual symptoms occur, then a specialist attention is called.
Thank you. Thank you, sir. Thank you. So you, in your initial talk, you talked about cataract. So we obviously understand that cataract is a very important disease, but many of our listeners would be in their middle ages. So tell us about cataract. What actually is cataract? And do children also develop cataract?
Thank you. That's a very nice question. See, cataract is essentially an opacification of the crystalline lens within our eye. Now, our eye focuses through the transparent glass in front of our eye called cornea and a lens which is shaped like a convex lens, which we all familiar from physics, which is present in our eyes and which, as we were talking about the marvel of the eyes, which can alter its shape to focus at different things. But with age, it loses that elasticity. That is one change, which leads to our requiring near glasses. But the other change that takes place because of altered metabolism in our body, because of changes of oxygenation or nutrition to the lens, is the opacification or loss of transparency of that lens. Now, when the medium through which we are looking at objects becomes hazy, the light rays that reach the retina, our light sensitive layer, are no longer clearly seen or focused. And that leads to diminution of vision. In the earlier stages, we may see colors, we may see double vision, we may see multiple vision, we may see halos around light. Those are all indicators that cataract may be developing. And once the diminution is to an extent that it starts affecting your quality of vision, then it requires surgery. And this is the commonest cause why vision becomes less in the older age group and requires surgery. Fortunately for us, the surgical management today is again a technological marvel that the procedure, which is so complex, which was started in our country by Sushrut, is now with us in a technological manner in which we can do a suture-less surgery, a bandage-less surgery, an injection-less surgery, and through a 2 millimeter incision, and the patient can be fitted with an intraocular lens which focuses as well as the natural lens, with provisions for being able to see for intermediate and near in appropriate cases, with provision for correcting our cylindrical error in appropriate cases. So the lenses and the technology for removing the lens through a very small incision have shown a lot of progress over the last couple of decades. As a postgraduate, the techniques that we learned in almost 4.5 decades ago are now history, and there's no similarity in ophthalmology to what we learned as postgraduates. So that has been the speed of changes, and that has resulted in a lot of comfort and a lot of improved quality of vision that we can restore to the patients of cataract.
Thank you, sir. Thank you for enlightening us. Now I'd like to come to you, Dr. Reena. Since we've been talking about lenses and you've talked yourself about myopia and the requirement of glasses. Now, at times I have seen, I've heard from people that the doctors has prescribed me glasses, but I don't want to wear, so I'm not going to wear. I mean, is it all right if I can somehow make do without wearing glasses, and I need glasses, I don't wear them?
Yeah, I think that's a very good question, because now we are seeing more and more people have refractive errors, which means they have a number. When the number is small and patients feel that they might be able to do without the glasses as well, they land up straining their eyes. And sometimes they're having symptoms related to eye strain. They might feel headaches or sometimes tired eyes and all. And sometimes some people can also develop muscle imbalance in the eyes because they're constantly straining their muscles to cope up with an imperfection in the number. So wearing glasses will definitely help them see the world better, and also keep their muscles in check and good balance, and reduce the strain that the eyes will have to work through if they're not corrected. People who have significant number usually land up wearing glasses because they're not able to see the world well enough to manage
Could you please speak a bit louder, Dr. Reena?
Yeah, so I'm saying that people where the number of the glasses is significant, they're usually far more compliant to wearing glasses. But it's the people when the number is not so high, that is the situation where people would like to consider, shall I do without or shall I wear them? But I highly recommend that if you have a number, if you see the world clearly and reduce the strain on the eyes, you are going to be feeling much better and your eyes are under less stress. Also, now there are a lot of options available to correct the power of the eye or remove the lenses or glass power that you have, either by a laser correction, which we hear very commonly as LASIK, or there are other refractive solutions also available. But to compromise on the quality of vision and straining your eyes might not be the best approach to this problem.
Thank you, ma'am. Now, I would ask you the next question in continuation to this. Please elaborate a little bit on LASIK, how to decrease the number or remove the specs, as many of our viewers would like to know. Is it possible to remove the spectacles by doing a surgery? What is that?
So as Dr. Grover was mentioning that eye surgeries have advanced a lot in the last 2 decades or so. And even the LASIK or so-called refractive laser surgeries have come a long way. And the predictability of the outcome of these laser procedures is very, very high. But the important thing to remember is that every candidate is not fit for LASIK. And a screening is extremely important. Before that, there is also a right age. You definitely want the eyes to have reached maturity, which means after the age of 19, 20, or 21 is the stage where we know that the number should stabilize in most people. And once you know that the number is stabilized, one can evaluate whether the eye is fit for treatment by laser for the number or the power that the patient has. If the fitness is appropriate, then LASIK and other refractive surgeries like SMILE and all give very good results. In situations where your cornea might not be healthy enough for a refractive procedure, there can be other surgeries also available for people who have very high power. But for smaller numbers, sometimes the surgeons might shy away by not offering you a surgical procedure to correct it, but to just wear glasses for at least all your visually demanding time of your life. Let's say somebody has a 0.5 number, a refractive solution by surgery is not going to be advocated. But strongly we'll recommend, at least for all the screen time and other visually very active time, glasses should be worn. There are, of course, options of wearing contact lenses as well, which is not permanent. You have to wear them, you have to remove them, but that's also an option. And eventually, after the age of, let's say, 50, 55, 60, when some amount of lens changes occur or frank cataract develops, cataract surgery also actually helps us remove glasses or become independent of glasses in majority of cases, thanks to the new latest lenses available, which can be very, very helpful in correcting power for both near and distance. And also, as Sir was mentioning, patients who have cylindrical power as well can be corrected both with laser in the earlier age group and by cataract surgery in the later age group. So refractive solutions are now available in many forms, and one can discuss with the doctor as to what might be the most appropriate solution for the patient.
Thank you. Thank you so much, Dr. Reena, for elaborating about the LASIK surgery and other available options. तो अगर आपके चश्मे का नंबर ज़्यादा है तो कुछ सर्जरी करके आपकी मदद की जा सकती है, लेकिन वो आपके डॉक्टर ही आपको बताएंगे कि आपके लिए ये ऑप्शन है कि नहीं है. Thank you so much. Dr. Subina, I'd like to come to you. I've had patients who say that they have some back pain or knee pain, and actually the problem is related to a disease in the eye. So are there any diseases, any systemic disease which can cause some problem in the eye? कुछ elaborate करेंगे इसके बारे में?
Yeah, very nice question, sir. This is basically a whole lot of diseases called under, they're grouped under uveitis. Uveitis, you have inflammation of the eye and you also have inflammation of other places. Many a times we have patient presenting with redness, watering, and we look at his eye, he has inflammation in the eye, and then because the problem usually is systemic, which is leading to all this in the eye. We get all the x-rays done and it is targeted based on his history and examination. It could be ankylosing spondylitis, which could affect eye. It could be tuberculosis. The patients, normally they say that most common cause of uveitis in Indian setup is ocular tuberculosis. So they say we do not have cough, we do not have fever, how do we have TB? So then it is that this is ocular TB. You could definitely have TB, which is limited to your eye, and it needs to be treated like a CNS TB. So it needs prolonged anti-tubercular treatment also. So these are the common things where the patient would be visiting an ophthalmologist, but the problem would be somewhere in the systemic setup. He could have TB, he could have syphilis, he could have ankylosing spondylitis, he could have SLE. There are many situations where the disease is affecting the whole of the body, and you have manifestation in the eye where the disease is picked up from the eye. But then we get the evaluation, basically radiological investigations and other serum investigations, which will give us the diagnosis, and accordingly we'll be treating that situation. And I think we should not ignore redness and watering, and we should visit an ophthalmologist and get all the investigations done before the treatment is started. And one more thing I want to point out, when Sir was talking about the childhood cataract. So that's very nice. And I would like to point out one important thing which must be done in children. We all have small babies in our home and we ignore all that. So if we just get a small, we do click pictures and we say, well, the eye does not look normal. If we get normal picture of all the babies after their birth, we do get that, and we would be picking up white eye detector. There's an application, a freely downloadable application which we could download on a mobile phone. When the baby is born, 1 year, 2 years of age, we do click pictures of the baby. And if we load those pictures in this white eye detector app, we could diagnose a it's a very deadly disease. It's retinoblastoma, the only disease which could be life-threatening for the babies. So these are the things which the awareness need to be spread. It's very, very simple thing. We do click pictures of the babies. We do click pictures on mobile phone. In case we put those pictures on the app of white eye detector and they find some abnormality, the app would tell there's something abnormal. Then you should immediately concern a doctor, and we should come out with any person having any small baby having a cancer in the eye and treat accordingly, because 99% of these babies can be saved. In India, the problem comes that the babies do not come to us in time and we miss the thing, and ultimately we have bad prognosis for these babies. So I think this is the forum to tell that please do this simple test for all the small little babies who are born.
For the benefit of our viewers, would you please again repeat the name of that app or application? What was White Eye Detector?
Yeah, White Eye Detector, which is an app which can be freely downloadable on our mobile phones. And then, in fact, last year we started this campaign in all the preschool children. When they were going to the kindergarten, we told the teachers to click pictures of all, because normally the schools are doing well. They say, get your ophthalmic examination before admission. But most of us are in hurry. We go to somebody known to us and we say, please write down, we know our child is normal. Write normal and we'll put the child in school. So that kind of thing is very common in India. But at least you detect for your baby, do this picture and see that baby is normal, and then put them in school. Because this affects
so much.
2 to
I think
5
आपने एक बहुत ही महत्वपूर्ण बात बताई है. इट इज सो सिंपल. आजकल हर आदमी के हाथ में मोबाइल फोन होता है. खाली एक पिक्चर बच्चे की लेके आप उसकी आंखों की अपलोड करके एक बहुत बड़ी बीमारी के बारे में पता कर सकते हैं. सो थैंक यू सो मच. आई थिंक दिस इज wonderful information, and I'm sure that our viewer and our audience is going to take benefit from this. Now, one thing which has quite disturbed me always, at least in my field, that is of diabetes, that people take a lot of non-prescription medicines,
Yeah.
they have this this notion कि प्रोफेसर ग्रोवर सर आप क्या कहेंगे कि आंखों में कोई भी दवाई डाल दें अगर वो कुछ आयुर्वेदिक ऐसी बहुत सारी चीजें आती हैं जिससे रोशनी तेज हो जाती है. Are there such things? I mean, do you advise your anyone to put anything in the eyes, or it can be damaging?
You hit the nail on the head. That is often a very, very harmful thing for two reasons. One is that it has the potential of harming the eye. There are a number of drops which may contain steroids, which have the potential to cause cataract and glaucoma, and these will provide an instantaneous relief for small symptoms like conjunctival congestion or allergy, and may be used for a long period of time by a layperson. So that is one very sad aspect, and we often find some children coming at a very late stage with near blindness due to having used off-the-counter drops for a long time for taking care of their allergy. Second important aspect is that in our country, it's very easy to market anything with tall claims. And every day we see the drops being marketed with claims of curing cancer, cataract, glaucoma. So the second harmful effect is that many people would delay the treatment of their eyes till a very late stage while they are under a false belief that these medicines may be benefiting them and taking care of their disease. So for both these reasons, we often tend to get harmed in a bad way by these. It's not to say that some of our traditional medications are not efficacious or not good, but we should increasingly do things with evidence. If we in fact, it's our duty to look at the traditional things. There are many beneficial things in our ancient wisdom, including some drugs and some exercises or yogic therapies, which have a huge potential benefit. But if we are able to evaluate them as scientists and show their benefits to the world community, we would be doing a lot of good to the population in general, to eye care in particular. So once we have demonstrated those scientific benefits and the proper indications for using those medications, I think they can be a boon, but at present, they are the bane.
Thank you, sir. तो कुछ भी अपनी आंखों में कोई भी दवाई जब तक आपके डॉक्टर आपको एडवाइस न करें न डालें, क्योंकि आंख में दवाई डालने से नुकसान हो सकते हैं. सबसे पहले तो दवा का नुकसान हो सकता है. दूसरा ये कि आपको हो सकता है कोई बीमारी हो जिसका आप इलाज न कर रहे हो, आपको थोड़ा आराम मिलता है तो आपको लगता है आप ठीक हो गए, लेकिन वो अल्टीमेटली बीमारी बढ़ती जाती है. जब तक आप डॉक्टर के पास पहुंचते हैं देर हो गई होती है. सो इट इज बेटर not to do any self-medication with your eyes. Dr. Reena, over to you. Tell us about eye donation.
Good. That's a really, really important and a nice question to answer. And I think eye donation or organ donation that way in India really needs to be spoken about, because the public awareness can really help us increase the number of eye donations made. So corneal blindness, this is basically blindness caused by the diseases of the cornea, which is the transparent first layer that you see above the black part that you see is a transparent layer. And if you get that transparent layer opaque by any means due to infection, injury, or any other disease, the only way to correct it is by changing the cornea and doing an organ transplant, which is the corneal transplant surgery. And to be able to do that, we need people to donate their eyes. And in India, the backlog of the corneal blindness that needs to be cured is huge, and the organ donation or the eye donations are far lesser. So if people can get out of that, of course, some of it is maybe religious related, limitations and otherwise, but it's just the sheer awareness that can help more and more people come forward and make the pledge to donate their eyes and organs for people who can benefit from them. We can give vision to many people who are blind due to corneal illnesses. So corneal transplant is a very, very successful transplant. Unlike the other organs like kidneys and all, here you don't need to give systemic immunosuppression. Only by giving some topical immunosuppression we can get very, very good results of corneal transplant surgeries. So I think on this forum, if this awareness can go out to more and more people, that an eye donation can help one person. If he donates both his eyes, two people can get sight and be able to see this world thanks to that eye donation.
आई थिंक इससे बड़ा पुण्य का काम नहीं हो सकता कि आप इस दुनिया से जाने के बाद दूसरे लोगों को रोशनी दे सकते हैं. आई थिंक दिस इज अ ग्रेट थिंग. नाउ इफ एनी ऑफ आवर व्यूअर्स वांट्स टू डू दैट, हाउ डू दे गो अबाउट इट?
So see, the National Eye Bank of India is a centralized body. They have centers, the nearest center, if you call up on the national helpline of Eye Bank Association of India, you will get the closest eye bank to you available. And those people will come to your doorstep to collect the corneas. So the whole idea is that if you're willing to make the eye donation within the first few hours of the demise of the person, you must reach out to the eye bank or the closest hospital where there's an eye bank. And the important aspect is that one doesn't have to worry. It doesn't disfigure the person or something. It's a very small part of the eye that is very neatly, cleanly taken by medical professionals. So it's a very quick procedure, and it has to be done in time. And if you reach out to the people by calling onto the national helpline, they will make sure that the nearest eye bank, a person from the nearest eye bank can reach out to you. Or you can even contact a big hospital in your near vicinity. They can also help you reach out to a person who can come and collect the corneas.
Thank you. This, I think, is also very important information for all our listeners and all our viewers. Dr. Subina, we are all looking at each other on our screens. Now, those times are gone when we were meeting each other physically. All our business now, especially the majority of our audience, I'm sure they're all working online, maybe from their homes. So the screen time has vastly increased, especially in past 2 years. So how is that playing on our eyes? Is it harming our eyes? What are the symptoms that people are facing because of this? And what is the remedy for this? Because we can't do without it. We can't do without laptops, computers, and phones now.
One thing is, yes, the changing lifestyle is the one to be blamed for this. Now we are more in virtual world. One thing important has to be told to everybody, especially the children, that it has to be some kind of balance. In case you are having 45 minutes of computer viewing, you have to take a break of 15 minutes, go around, rest your eyes. Break does not mean leave television and leave mobile phone, go to TV, leave TV, go to mobile phone. You are again concentrating and you are onto screen again. It means you go out, you take some time out, go in open, come back, or take a round of the house, come back and sit again, and then again start your work. And in 1 minute, normally we blink 16 to 18 times in 1 minute. And once you're looking at screen, you stop blinking. Anybody you would have seen looking, they would be staring at the screen, anything you're doing with concentration. So your blinking stops and your tears resurfacing stops. So what we usually say is that computer, you should have some kind of screens on top of this computers, plus you should have tear supplements. You can put tear supplement. The usage has increased tremendously because of this, and it is really very, very helpful to control the symptoms. The patient would be having dry eyes is increasing because of air conditioning also, that's playing a role. It is again increasing the symptoms of dry eyes. So it's become, in fact, a major challenge nowadays to manage these things. And most of our OPD is now, I would say, dry eyes and allergic conjunctivitis most of the times. And I think this is, if we modify our lifestyle, it will be a lot better, and we should look into that and decrease our screen time and always remember to blink, and it should be not concentrating onto one thing always. You should have movement of the eyes, you should go out, you should come back, and it should not continuously be seeing the computers.
Is there any specific period like आधा घंटा या 40 minutes? How long can we, like in a
I would say
session,
for
look at?
yeah.
Yes.
No, I usually tell my patients that 45 minutes and 15 minutes because they would not listen. वो कह रहे हैं जी हमारी तो क्लास ही 45 मिनट की होती है. I said ठीक है 45 मिनट के बाद थोड़ा चक्कर लगाया करो, then it becomes better. So I think we could say that. And then tier segment person would have better answers for that, I'm sure, because we have basically retina practice. I think Sir would throw more light on that. Yeah. Dr. Grover, Sir, the take on this?
So you're muted,
You're
sir. Please unmute yourself.
The dry eye part of it.
Yes, sir.
So what is most important is that tear substitutes are good. You can use lubricants off the shelf that are available. They would give some relief, but it is important to diagnose the cause. As we know, almost 50% of our population over the age of 50 has dry eye, and most of that dry eye is because of the lack of oily layer, which is not the same as watery layer. The oily layer is protecting the watery layer from getting evaporated, and the foreign body sensation that you have and the burning that you have is accompanied by watering, which is paradoxical. So many people will have watering as the symptom, in fact, when they have dry eye. So it is important to diagnose them well and treat that specific cause for lasting relief. So that is very important, rather than just treating yourself with off-the-shelf tear substitutes. And of course, all the precautions that Dr. Sabina has talked about, or Dr. Ina spoke about, are all important for maintenance of the health, the rule of 40-40 or
So how long
20,
can we
20
look
or-
at the screen, the laptop or computer at a go, sir?
There are no hard and fast rules. It will depend on the individual person's health and eye, but giving yourself a break every few minutes, every half an hour, every 40 minutes would be the ideal thing for everybody, so that the blinking is done and the tear film is restored back, which tends to become less with the concentration that we are doing, and the blinking is reduced, and therefore the lubrication on the surface is reduced. So that is augmented when we take a break, and it helps us to get back to normal.
थैंक यू सर. सो हर 30 से 40 मिनट पे आप को एक रेस्ट देना अपने आप को जरूरी है. सर, द नेक्स्ट क्वेश्चन, ट्रेलिंग क्वेश्चन आई वुड से इज टू यू. Food plays very important role in maintaining our health in all the vital organs of body. So how does food affect our vision and eye diseases? Is there some special diet, or there's some things which would help us look better?
So, Dr. Rajesh, as you pointed out, there are a number of diseases that affect the eye. It is because the eye has the same tissues as the rest of the body. So,
Yes, sir.
a healthy eye lives in a healthy body. So, in that sense, a good nutrition is essential for maintenance of all the tissues that constitute the eye. All the structures of the eye are again the same tissues which are present elsewhere in the body, the connective tissue, the muscles, the nerves, and the arteries and the vessels. So that is why, as you were also mentioning, the eyes act as the kind of window to the entire body, where the vessels are not vessels are visible to the clinician, and he's able to diagnose any diseases of the vessels and able to treat them by looking at the eye. So similarly, a bad nutrition has an impact on the health of the eye. Of course, there were some specific diseases like malnutrition related xerophthalmia, or vitamin A deficiency causing melting of the eye, or keratomalacia, which was specific to malnutrition, which have become much less as the nutritional status in the country has improved. But even otherwise, health of the eye is best maintained when we eat all the balanced diet elements that are necessary. And with aging particularly, the antioxidants become important. So having good nutrition of fruit, vegetables, combined with a good deal of exercise is important for preventing the age-related diseases like age-related macular degeneration or glaucoma, which are due to lack of blood supply. So if we maintain our health well, all those problems would reduce or decrease. Even cataract, for that matter, is an age-related change.
This is really very interesting, and I'm sure a very useful information that having a good and a balanced nutrition together with good physical activity is helpful in preventing all the systemic diseases like diabetes and blood pressure. Not only these, but in maintaining good eyesight as well. Thank you so much. I think this is a very important recommendation. Now, my question to all of you, maybe whoso would like to contribute, can you recommend some exercises or something that our viewers could do by themselves in their offices, in their homes, which would help improve their vision or decrease strain? If any one of you would like to contribute to this.
Dr. Reena?
Yeah, so I think eye exercises are, eyes also have muscles, as Dr. Grover just mentioned. So anything that's keeping your body fit when you're walking or something keeps your muscle in good tone. Similarly, if you desire, you can do some very common eye exercises, which can be moving your eyes left, right, up and down, and doing convergence exercises, which means that we are basically working our muscles that help us focus. You can take a pencil, put it at an arm's length and focus at the pencil tip and slowly bring it closer to the center of your eyes or towards your nose till you're able to still maintain a single image of that pencil tip. When you lose it and it becomes double, that's the point when you know you've reached either too close to your eye or your ability to converge is not adequate. So you can slowly keep working on it. But this is not something that everybody must do. But these can be helpful exercises that you can make as a part of your routine workout that you do, whatever physical activity you do. But I think generally a good, healthy body which eats well and maintains a good amount of physical activity, I think does good to your eyes overall. And specific workout for the eyes is not really required often, but people who have muscle imbalance a lot can really benefit by doing simple convergence exercises or doing ocular muscle exercises.
Thank you. Thank you.
I'll
So
just
you
add
want,
a little
yes,
thing.
yes, yes.
As Dr. Reena pointed out, fortunately for us, the eyes are designed to work 24/7 and they never tire. So they don't need physical exercises as such, except for muscle imbalance or something. But one common problem that people over the age of 40, 50s often have is eye strain and headache that they develop with visual work, which is because of associated cervical spondylitis and change in the posture, leading neck bending, which occurs with visual work causing strain. So exercises for the neck for them may be very helpful, and a proper counseling and treatment from orthopedic surgeon or from a physiotherapist may be very helpful to them. Of course, in muscle disorders or in specific convergence disorders, muscle exercises for the eye may also be indicated.
There's a question which comes very commonly to me as a physician is that people have swelling under their eyes, and at times people have approached me, Doctor Sahab, koi meri surgery kara do, meri aankhon ki cheez swelling ho gayi. So is that a disease? What is it?
Anybody?
So that's your area, I think. If they're asking about the puffy eyes, then
So those are essentially fat bags protruding from the back of the eye, and that's one of the commonest manifestations we have with age in our country. Unlike in West, where the wrinkles are much more common, fat bags are the commonest manifestation with age, and most of us have it to some extent. And fortunately for us, they can be managed quite well. We can take care of them by repositioning those fat bags or removing those fat bags from inside of the eye in most cases without leaving a scar. And in some earlier subtle cases, we can avoid the surgery and just do injection of volume additive things like fillers. So those can work wonders for people's confidence and their ability to face the world. Those who are conscious of their fat bags, those can be taken care of very well. In fact, oculofacial aesthetics has become a major branch the world over, and the use of Botox and use of fillers is the single most commonly done procedure in the world today. And that happens to be one of my specialized areas associated with oculoplastics.
Thank you, sir. And one more common thing that that many of the patients relate is that they have small yellow swellings on their eyelids. Do they need removal, any surgery for that, or they can be cured with medicines?
Dr. Subina, will you take them?
So it's the same as xanthelasma again. Question to you, sir. So I think in our setup, skin people are dealing with it. We do not, we refer to skin, so they do take care of that. I think you must be doing it yourself. So
Yeah, those are xanthelasma, or really, in fact, cholesterol deposits under the skin, and they tend to cause a fairly significant cosmetic problem. And the best way of tackling them is surgical. We need to remove them because any other method done from the surface does not give lasting results. So it again comes in the field of the oculoplastic surgeons. And they can be removed very well without leaving any scars. And at the same time, one should ensure that the serum lipid profile is normal so that the patient is not likely to get them repeatedly. And by a procedure called blepharoplasty, we are able to remove them and without leaving any scars and take care of those deposits called xanthelasma.
Yes, and I think these are very important because these are one of the earliest indicators that the blood cholesterol levels are high, which could ultimately lead to much more serious disease, not just cosmetic like high blood pressure, coronary artery disease, heart attack, so on and so forth. So if any one of our viewers has this problem, they should consult a physician and do their blood tests, just as I had said about the lipid profile also. I think we had a wonderful session. We've discussed so many wide-ranging topics concerning ophthalmology and from different fields of ophthalmology. I'm so thankful to all of you. Now I'd request all of you, and moreover, since you are from different fields of ophthalmology, to give a small message to our audience and our viewers. Starting with you, Dr. Subina.
yeah, I would say prevent, we should take care of all cause of, preventable blindness should not happen. The worst thing is what we can prevent, that would be with yearly checkup. Please visit your ophthalmologist and be liberal about going to ophthalmologist, not saying ki it is waste of time, it never is. And you try to manage. काम चल जाता है. Just take off that line of काम चल जाता है. काम नहीं चलाना, हमें quality of life lead करनी है. For that you need to come to an ophthalmologist.
Thank you. Very true. Very true. Dr. Reena, what is going to be your message to our viewers?
I think, as Dr. Subina said, prevention is better than cure. And to be able to prevent and diagnose things early and maintain good vision for people, it's very important that we go and get our annual eye checkups done. And one important message is that after the age of 40, many of us require reading glasses. And very often we go to opticians or shops and we get our number checked and take the glasses, but we miss that opportunity to have gone through a complete comprehensive eye checkup. So I think if you get a comprehensive eye checkup every year after the age of 40, you'll be able to pick up silent asymptomatic stages of these diseases, which can really help us prevent these diseases from getting worse and causing any visual disability. So please pay attention on the whole basic fundament of prevention is better than cure, and annual health checkups, no matter just the eye, but even otherwise, knowing your cholesterol profile, making sure that your blood sugars are healthy, your blood pressure is good, can help us take our health along with us in a long run.
Thank you so much, Dr. Reena. Professor Grover, sir, what is going to be your message to our viewers?
I'll just repeat what our ancient scriptures said and what I said earlier in the course of discussion. पश्चिम शरदा शतम को हमें सबको संभव बनाना है अपनी आंखों की देखभाल करके, और उसके प्रिवेंशन के लिए जो कुछ डॉक्टर सुबीना ने, डॉक्टर रीना ने कहा, वो बहुत ज़रूरी है ताकि हम इस गिफ्ट ऑफ साइट जो हमें नेचर ने दिया है या ऑलमाइटी ने दिया है, उसकी सुरक्षा हम ज़रूर करें। उसके लिए हम ऑलमाइटी के को धन्यवाद करें और उसके दिए हुए इस गिफ्ट की सुरक्षा करें, नियमित जांच करा के। ये दिस इज द वाइटल मैसेज कि दैट prevention and seeking treatment for a disease at an early stage are the best ways of uh, providing that insurance to our site, which will preserve it for a long, long time, and which we really need to do.
Definitely.
Thank you.
Thank you
And
so much.
thank you, ASSOCHAM, and thank you on behalf of all of us. Thank you, Dr. Rajesh. Thank you, Mr. Rajput, for this opportunity.
Thank you.
Thank you.
Just a moment, sir. Over to Shri Anil Rajput, sir, for a vote of thanks.
Thank you. Thank you very much. Words are not enough to thank all of you for coming and sharing your experience, knowledge, and giving words of wisdom to all the people who joined us today. And many of them will propagate this message to their kith and kins, near and dear ones. As Dr. Grover very nicely mentioned in the beginning, that eyes as a marvel, eye as a marvel, you know. Eye is the jewel of the body. That's the kind of message that Dr. Grover gave to us. And really grateful to you for coming and sharing your knowledge with us. Everybody should go for a regular eye checkup and don't miss this opportunity. Just don't chalta hai attitude will not help. You know, you must take preventive measures so that you don't get into a trouble which is avoidable. You know, as one of the doctors I mentioned, prevention is better than cure. So, all the listeners, it is our request that you kindly take the notes that our panelists have given to you for your benefit. And I would like to, extend my heartiest gratitude to all of you for coming and sharing your inputs with us. Thank you very much. Thank you.
Thank you so much, everyone. Thank you. Namaskar.
Thank you.